Indiana's Medicaid expansion, known as the Healthy Indiana Plan 2.0, is often referred to as a national model as Republicans try to scale back the Affordable Care Act. Now, new research is revealing more about the actual impact it is having in Indiana. Seth Friedman is one of the authors of the analysis and joins us now. Thank you so much for being here.
Thanks for having me.
So can we start by just explaining a little bit about what makes Indiana's Medicaid expansion so unique?
Sure. So Indiana's expanded Medicaid as a part of the Affordable Care Act about 1 year late in 2015, and with some unique characteristics. In particular, it requires enrollees to pay a small amount of money into an account that acts sort of like a health savings account. That money, along with some money input from the state, is used to pay for the first little bit of health care that they consume during the year. And then if they have money left over, they can roll it over to the next year.
And this all happened, what, about 2 years, 2.5 years ago?
Yeah,
HIP
in 2015 it began. Yeah.
And so now it's been a little bit of time. What kind of impact has it had here in Indiana?
So our research is specifically looking at how it impacted insurance coverage. Did people actually enroll in new coverage? And it might have a smaller impact than what's happened in other states, because if Hoosiers don't make these payments, they get less generous coverage, or they can, depending on their income, actually be removed from the program for up to 6 months. And so we were interested to see how the effect on coverage compared to other states that implemented more traditional Medicaid expansions. And what we found was that actually Indiana's coverage increase was not too far out of line with what happened in other states with more traditional expansions. It did lag a little bit behind some of its neighbors like Illinois or Ohio, but overall there were many states that actually had smaller increases than Indiana had.
Is there any data, though, how this has really impacted Hoosier residents, though?
So the first thing that we've studied so far is just, do they have Medicaid insurance?
Okay.
What we're really interested in, and what we really need to follow up on, is how is this impacting their ability to actually obtain health care, how it's affecting their health, their financial well-being, and their other parts of their lives. So that's for future research that we're interested in continuing with. And
we hear that, Trump administration trying to do away with parts of the ACA. Could they look to Indiana as being a national model?
It is certainly something that states around the country are looking at, and other states that are changing their Medicaid programs, or states that have not expanded that are trying to expand, are looking to certain components of what Indiana has done and copying them. Now, one thing that Indiana has done more recently that we haven't been able to study and that other states are doing is work requirements. That's also something new that we are yet to really know what the effect will be.
So much to get to. Thank you very much for being here.
Thank you for having me.
Now.